Fantastic. Hello, everybody. I'm going to wait a couple of minutes for people to come in from the waiting room. Welcome to the JHWiki Virtual Toolkit series. All right. Marina, what I'll do is I'll just wait for you to make sure everybody's that's in the waiting room is in, and then give me the thumbs up, and I'll get going.
Thumbs up. Everyone's in the waiting room.
Fantastic. Okay. All right. Hello, everybody. My name is Allison Agu. I'm professor of adult and pediatric infectious diseases here at Johns Hopkins in Baltimore. In this role, I am the program director of the JHWiki virtual program. And you're welcome to join us for our virtual toolkit series. And the goal of this series is to engage and amplify. Next slide, please, Marinas. So briefly about JHWiki, we are a Part D HRSA funded initiative that is the goal is a partnership for excellence in HIV care across Central Maryland. We include 6 programs across Baltimore City, the Johns Hopkins HIV/AIDS program here, the Hopkins HIV Women's Health program, Sinai Hospital, University of Maryland HIV program, and the Johns Hopkins Emerge Gender Affirming Services for Youth, and the Johns Hopkins HIV Psychiatry Service. And the goal really is to provide a more coordinated response to HIV care by working with each other, but with all of you. So expanded beyond Hopkins and our programs to improve outcomes for women, infant, children, and youth across Central Maryland. Build upon our structures, share across a multidisciplinary systems of care to improve outcomes. The goal of this series here is to engage and amplify experts. So you hear me say multiple times, if you see something, say something. We want to hear from you as well. So it's not just amplifying our voices, but amplifying yours as well. We have been doing the Toolkit series for about 2 years and have really engaged people across Maryland, across the United States, and actually I want to say across the world with attendees from multiple countries. Next slide. Today, I'm so excited to have Dr. LaTrice Montgomery join us today for the title, Getting Lifted, the Cannabis and HIV Connection. And Dr. Montgomery, I don't know if I told you, we were thinking about this, and I literally looked up and started to do some research and found, oh, this is who's NIH is funding. Here's who's doing all the work. And so let's tell them about you. I'm so excited you answered my email. Dr. Montgomery is the Director of Clinical Research at RIA Health and an adjunct professor at the University of Cincinnati College of Medicine. She received her Ph.D. in clinical psychology from the University of Cincinnati and completed her clinical internship in the Department of Psychiatry at Yale University School of Medicine. Her research focuses on cannabis and tobacco use and the co-use, especially via blunts, which we all track for our patients, alcohol and substance use disorder treatment, and advancing health equity. She is an associate editor for the Journal of Substance Use and Addiction, Treatment, and Cannabis Journal. And she's also a standing member of the NIH's study section, Interventions to Prevent and Treat Addiction. It is my extreme pleasure to have you join us today to talk about this topic. Take it away, Dr. Montgomery.
Perfect. Thank you so much. I'm excited to be here with you all today, and a little nervous because I know there's some, wonderful people on this call who know far more probably about this than I do, especially as it relates to the HIV, but I will do my best. As noted, my expertise is primarily in cannabis, and so I focus a lot of my attention there, but we'll also talk about, of course, the cannabis and HIV connection. I also had the pleasure of reading a few of the questions that were submitted in advance, so I'm happy to actually cover some of those. So I'm glad to see that we're kind of on the same wavelength with those. But then also at the end, I'm happy to take any questions, and I'm happy to just have a conversation about this because this is a very interesting area. Lots of fascinating studies coming out in this space. So just to review again the objectives here, I'm going to talk some about the prevalence rates of cannabis use in the general population and among individuals who are living with HIV. I'm also going to talk about the different modes of cannabis consumption and how they might impact the body and how that influences that question that we're always asking of, yes or no to cannabis for individuals who are living with HIV. And then, of course, describing the effects of cannabis on health, especially among individuals living with HIV. So to jump right in, what do I mean when I say cannabis? And I always like to just kind of start off here just to make sure we're all on the same page about what's being discussed. And so, of course, I'm talking about the dried leaves, flower stems, and seeds from the cannabis sativa or indica plant. And this certainly has implications, especially when we think about the medical use of cannabis for HIV-related symptoms, et cetera. And as you'll see in the figure, the indica tends to have more, it's a strain that has more of a relaxing effect. And so it's often used at nighttime, whereas sativa has more of an kind of energizing effect, which is preferred for daytime use. And as you might imagine, the combination, there's kind of variable effects with kind of the body buzz and the more hallucinogenic effects from the strain. So of course that impacts how that influences one's body. What we know most about are tetrahydrocannabinol and cannabidiol, or THC and CBD. So typically when you hear about, especially the negative impact of cannabis, oftentimes it's products that have higher levels of THC in it, which is the psychoactive component. And then there's CBD, which also tends to be used more kind of when we think about the kind of therapeutic effects of cannabis. Sometimes, oftentimes CBD is mentioned as the cannabinoid. But of course, there are several other cannabinoids and components, terpenes, et cetera. And not, again, that's not really my area of expertise, but they are being studied, and they definitely have their own individual impacts, which will, of course, impact how it influences the body when used. And it's important to note that, of course, cannabis is the most widely used federally illicit drug in the United States. And I'll come back to that point throughout the presentation, but just to remember that piece. And you'll see here in this map, it was updated at the beginning of this month. And you'll see here that mostly every state has some type of law related to cannabis. And so you'll see it's legalized in many places, both medical and recreational use. There are some places where it's medical and decriminalized, usually with a certain amount. There's no kind of criminal associations with it. Of course, there's medical, and then there are some places that allow for THC, but it has to have CBD with it. And then there's only a fewer states where it's fully illegal. There's no type of law associated with cannabis. So I always like to show these because, again, this certainly impacts the perceptions that people have about cannabis. And of course, as you see this, you would think that our messaging around, reduce your cannabis use or don't use cannabis at all, sometimes they can be hard to get across when you see something like this, because you're like, well, it's legal or there's some sort of law, and so there must be some good things about it, right? And so and at least in my research and in my experience, that's oftentimes the questions that I get. So I'm hoping that today I can help to address some of these larger issues related to cannabis, and specifically as it relates to people living with HIV. So just as a kind of an overview, this is data from the National Survey on Drug Use and Health, data from 2021 among individuals 12 years of age and older. And you'll see that about 21.9% of the population engaged in illicit drug use in the past year. And of those individuals, cannabis tends to be, again, the most used drug in that category, with about between like almost 85, 86% of those individuals using cannabis. And then you'll see these other illicit drugs that are listed here. So again, the use is high in the general population. To also provide more context from the National Survey on Drug Use and Health 2021 data, you'll see that again, cannabis, the rates of cannabis use are high. And then also other substances like alcohol, tobacco products, which are also issues among individuals in the general population and among individuals with HIV as well. So just some context here to think about kind of where this fits in the landscape of other substances that are used. And also just showing, this marijuana vaping. I'm going to talk some about this, and I think in the next slide or so, you'll see here that this is becoming a huge issue where the National Survey on Drug Use and Health is actually now starting to assess this issue about vaping cannabis. And so you'll see just by the figure here, by this graphic, you'll see that a lot of the vaping is happening among 12 to 17-year-olds. So that, of course, is extremely problematic. And so, that's an area to look out for as well. But I wanted to touch base on just the different types of cannabis methods. And so this is really important because, again, when people are asking just that general question of should someone with HIV use cannabis, or what is the association, which comes first? Is it oftentimes that, individuals are using cannabis and then may happen to develop or, get HIV, and then they continue to use, or do they start to use after they're infected? There's all these sort of questions around it, but it's such a complicated question when you think about cannabis and any other type of condition or cannabis use in general, because there are several ways in which cannabis can be consumed, and they all affect the body differently. So of course there are capsules or just pills that people can use. And this again is often used with medical cannabis, or just like you would take, an Advil or anything else, there's something similar for cannabis products. There are also edibles. So essentially anything that you can eat, drink, there is probably some THC formulation that can be used in these particular products. There's also tinctures, which are kind of like alcohol-based extracts typically placed under the tongue. There's also these oils and patches, creams, ointments, etc. There's also a dab, which can be extremely dangerous. It's designed to heat like cannabis concentrate, so wax and things of that nature, which tends to have high levels of THC, so it can be very potent. And so this can get up to like 90% THC, which is, can be very dangerous, especially for novice users. So there's not something that if someone were starting off using cannabis, that's definitely not the best thing to start off with, because it can become very dangerous with the potent levels of THC. There are also blunts, which is what I spend a lot of my career focusing on. And as you'll see here, it's kind of this, you see the brown paper around it, and it's actually a little cigar, a cigarillo. And what happens is people often remove the tobacco from these products and replace it with cannabis. And so the users are exposed to both cannabis and tobacco. And so a lot of what I do is actually exposure, is talking about this particular product and kind of giving some education around it, because not only do you have to worry about the effects of cannabis, but you also have to think about, well, what does that mean with the tobacco? And so there is these misperceptions, for example, especially among younger people, that, well, if I remove all of the tobacco, I should be okay. This is just, it's just weed. It's not a big deal. But what they may not realize is that there's still a quantifiable level of nicotine within the wrapper. And so even if all the tobacco is removed, there's still some level of exposure to nicotine. And of course, as we know, there are issues associated with tobacco and HIV as well, such as like HIV-related oral lesions, for example. So lots of things to think about when we think about that product in particular. And then, of course, there are traditional joints. That's essentially what we think of when we think about cannabis use. We think of consuming it in the joint. There's a translucent paper. It's just kind of rolled up, and cannabis is placed in it. Then there's also the vape pens, which I vaguely mentioned, which again can heat cannabis to high levels as well, but it's typically oils. It's not, can't really get as potent as you can with a dab, but it still, can be dangerous. And as I pointed out, it's happening even more among youth now, which is concerning. So I point all of that out because that certainly has implications for, again, that the question of, is it effective or not? So just keep in mind as we talk about this, that you'll see in this graphic about how cannabis affects the body. There can be good effects and bad effects in between. And it, again, depends on how much is consumed, et cetera. So if we think about just cannabis in general, typically you hear things like there's memory impairment and slow reaction time, and there's these respiratory effects and sort of these negative and things that especially are associated with products that have higher levels of THC. But you'll also notice in the graphic that there are some potentially helpful things, helpful effects that may take place, such as the effects on digestion, and that can stimulate appetite, which is, can be which can be helpful among, for example, someone with kind of wasting syndrome. That could be especially helpful. And so there's different ways that cannabis impacts the body, and it, of course, is different for every person. And as I mentioned, this is just a graphic of kind of what I've been saying before, is that the way that these products hit the body, it impacts what happens to a person and how they feel it. So if we look here, when cannabis is inhaled, whether smoke or vape, you'll see that within that first 15 minutes or so, it's at its strength, the highest strength of effect. And this is kind of more, subjectively based on research, but looking at the strength of the effect, it can be at its highest within about 15 minutes. And so, people that are smoking, they're used to that immediate effect. Whereas if you look, and then of course, over time, it kind of dwindles down. But if you look at oral cannabis, and when it's consumed orally, you'll see that, there's not a real effect until about 30 minutes to an hour in. And this can get dangerous because, of course, especially if we are not as well educated about that, you may assume that, well, hey, when I smoke, I feel it immediately. So if I take this brownie and I don't feel anything within, the first 10 or 15 minutes, you think, well, it's not working. Let me take another one and another one and another one. And then next thing you know, you're in the emergency room because you've consumed all of these oral products. And so that's what's happening, where we've seen an increase in emergency room visits, because oftentimes people are unaware of this kind of delayed effect, if you will, related to oral cannabis. And then, of course, with sublingual, it's kind of, again, there's kind of a little bit of a delay, but then you'll see that it goes up and then kind of gradually comes down. So it's important to know this. And so that's one thing that I would say, in talking about this topic and this issue, is that patients and people that we work with should be educated about this. There's a lot of unanswered questions with cannabis, and I'll talk some about that throughout this presentation. But there are some things that we do know, and these are things that we do know for sure. And so I think it's important that people are aware of this, and that if cannabis is, what they decide to consume, that they're, are aware of the type of products that they're using, and the different ways that it might impact the body, so that way they can use it in a way that's safe and effective for them. And I do want to give just some context around cannabis research, because I think it's relevant to the conversation. And I've kind of alluded to the point about the different modes of consumption. As I noted, they can impact the body differently. And so when we do our research, it's important that we talk about which modes of consumption we're talking about. And unfortunately, that doesn't always happen. And so a lot of studies that we have now may talk about cannabis use more broadly, where they don't talk about the specific modes, or they may specifically refer to joints, which is fine because that's still the most common method of consumption. But as I noted, it's not the only method. And so without knowing that information, it's a little different. I mean, it's a little difficult to draw conclusions from studies that say, oh, cannabis and, anxiety are linked in some kind of way. What's like, well, how much cannabis and how do they consume it? And those kind of questions we just haven't really got a good grasp on more broadly. There are some great studies that are out, so don't get me wrong, but in terms of just the general field, that's definitely an area that we have to work on and get some consistency in. And speaking of consistency, there's also been conversations around a standard dose, and this would really help in the research space. So if you think about alcohol, for example, when we think about standard drinks, so if we talk to our patients about alcohol use, we can say, more than, 4 more drinks for women, 5 or more drinks for men, can be problematic. And we can give specific directions to people about how to use alcohol if that's what they choose to do, and what's problematic. But we don't have that same sort of approach with cannabis. And so when we say heavy cannabis use, for example, well, what does that mean? Does that mean daily cannabis use? Does it mean, even with that, is there a certain type of product that we're referring to, et cetera? So that is a problem. But I do want to point out that in the research space, at least with NIH, there has been now kind of a standard dose of 5 milligrams of THC for research studies. Again, this doesn't mean that you have to, do everything with 5 milligrams. You can use, however many milligrams you want, but in reporting results to the public, especially reporting in that 5 milligram, using that as a standard dose so that when we talk about, the impacts of cannabis, for example, we're all speaking the same language. Again, it's not nice and neat because there are some people who say 10 milligrams is a better way to go rather than the 5 milligrams, but it is a start. And of course, that's again in the research space, specifically with NIH, but in terms of like just general research or even within NIH, there's definitely some work that can be done around that, but it's a start. So it is a good thing. There's also an issue of medical versus recreational use, which is not always teased apart in our like national surveys and even, in our, surveys that are done in different projects of understanding the difference between the two. And this is really important of why people are consuming cannabis. And one of the things that I've seen in some of the studies that I've done here in Ohio around cannabis use is that in some of my initial surveys, I would ask about, the medical use of cannabis, and people would say, oh, of course, I'm using medically, I'm using for, anxiety or depression or pain or whatever the issue might be. But then when you dig a little bit deeper, I find that they're actually using it recreationally, or they're getting cannabis off the streets or just from their regular supply and not going through the actual program that is set up by the state. And so there's sometimes people don't realize that even if you're in a state with medical cannabis, that there's still a process and that you have to go through the actual program and in order to get the regulated cannabis within that state. So so even the way we ask questions of just not just are you using cannabis for medical reasons, but are you enrolled in your in the cannabis program? Do you have a medical cannabis card, et cetera? And sometimes those things aren't always teased apart. So that's something to think about. And then, of course, the cannabis research apply, which gets back to some of the issue when we're trying to conduct studies, especially NIH-funded studies. Right now, University of Mississippi is where we receive cannabis from in order to do research in this area and kind of do clinical trials or whatever it might be. I know that there were some conversation, and I don't follow this as closely, so maybe perhaps someone on this call could update me as well about allowing other organizations or universities to also contribute to the supply. I don't know what the status of that is today, but that is a conversation that has implications, because if you think about it, cannabis has changed so much over the years, and it's so diverse across the country. And what may be used, here in Ohio might be completely different than what's used in other places around the country. So we have to be mindful of that as well when we're reporting on cannabis results. And then, of course, there are funding limitations. I keep referencing NIH, but that's because they're the largest biomedical funder. And so it's important that there's a lot of this work is coming from there. And also, if we take NIDA, for example, the National Institute on Drug Abuse, and then think about kind of like the mission of it. And so traditionally, especially when we think about medical cannabis, traditionally NIDA has focused on kind of, the treatment of, say a cannabis use disorder, for example, or alcohol use, not alcohol use disorder, but like a stimulant use disorder, for example. But this is a little bit different in that, we may be talking about kind of the therapeutic effects of cannabis and what does that look like, and are there therapeutic effects, which is a little bit different than what, at least my understanding of what NIDA has set out to do. So seeking out different funding mechanisms, and then sometimes it can be difficult, especially when you have, kind of just this general perception of with cannabis, it's not that big of a deal. It's not like, no one has died from cannabis. It's not like opiates where, that's kind of the big thing, and overdosing and, issues related to that area. So sometimes it can be a little difficult to get the funding that's needed to kind of push this, push it forward. But there certainly are, over the years, there's certainly been many more funding mechanisms that have opened. So I don't want to imply that that's not happening, but certainly relative to other types of substances, it's an area that could use some improvement. And so again, just wanted to give some context because these all have implications for the things that I'm going to present, and just for any conversations that we have about, with our patients and with, people that we work with about cannabis as it relates to HIV. Okay, so let's go ahead and jump in and talk specifically about this connection between cannabis and HIV. So it's much more prevalent among individuals that are living with HIV than among the general population. So depending on which study you look at, between 23 to 56% versus about 13.3% of the general population. The prevalence varies based on the specific populations, whether it's, surveys or like there are some groups, as you'll see here at the bottom, are more prevalent among young HIV positive men who have sex with men. And so depending on the different subsets of individuals that you're looking at, you may see higher rates of cannabis use. And again, we don't know always, is it medical use, is it recreational use? And the kind of context around their use is sometimes unknown as well. So, and then you'll see here 22 to 67% of people living with HIV who are current cannabis users report current medical use. And so in that case, where we're specifically asking about medical versus recreational use, you'll see that the rates are very high. So it's important for us, this kind of highlights the importance of needing to know and have some information about this, because regardless of where the science stands and regardless of what our personal opinions may be about it, clearly people are using it. So I think, my position is always just to provide education so that people can make the decisions that's best for them and their health. So this is from a study conducted in 2019, just thinking about, why might people use cannabis in the first place, especially among individuals living with HIV, and, why it might be higher than, say, the general population. And so when looking at individuals who are with HIV, some of the reasons you'll see are to reduce stress and anxiety. And oftentimes the stress and anxiety can, come in different forms or fashion. We talk about general stress and anxiety that anybody might feel just living in this stressful world, just everyday stressors, but also stressors related to diagnosis, receiving an HIV diagnosis, and then going through treatments, and just the stresses that come with it, and the side effects of ART medication, and and on and on and on. So, thinking about what that looks like in this landscape and how cannabis might be used to cope with some of that. There's also symptoms, and I'll talk some more about that, specifically symptoms related to HIV, but also symptoms related to other medical conditions, just with the co-occurrence of HIV and other types of conditions, especially among older individuals, whether it's arthritis or chronic pain, et cetera. And so sometimes it might be taken to deal with those particular conditions. It might just indirectly have an impact on HIV or not. Then of course, social reasons, and just, again, like the anxiety and, stress that could come along with just many different things, weight gain, appetite stimulation. And so again, I talk about the wasting syndrome, which I'll talk some more about here shortly. And then of course, just general pleasure, and wanting to get, maybe just relief from just the stress of, everything. So another thing I want to point out here, I know there's a lot, and I'm happy to share these slides because I know there's a lot here in these tables, but another thing that I want to point out is that you'll notice that when people are talking about, different symptoms that they're experiencing as a result of using cannabis, oftentimes people are not reporting, that they're experiencing sort of these really, kind of intense or even moderately intense, effects or negative impacts of cannabis. And so when you think about if you feel like in the moment that it's providing some sort of relief for you, whether it be relief with quality of life and just at least a brief reduction in pain, whatever that might be for a person, and there's no real negative impacts. There's no, when we think about the negative impacts like memory impairment and all the things that we hear about relates to cannabis, if you're not experiencing that and you're experiencing kind of these, more therapeutic effects from it, then, it would make sense that that's something that you would continue to use and lean on and use. So just some areas. And then looking at perceived effectiveness of cannabis among individuals with HIV. And there's a perception that it's more effective for anxiety, nausea, neuropathy, but that is slightly, that medications are slightly more effective for diarrhea and fatigue. And so you actually see this sort of breakdown when you think about, if you look across different states that have medical cannabis programs, oftentimes the HIV/AIDS is listed. And then when we look even deeper, the anxiety, the nausea, neuropathy, those are the common reasons that usually raised to the top of why people are taking it. And then less with like diarrhea and fatigue. So this kind of plays, that perception really plays a role in how people are using cannabis, whether or not, again, regardless of kind of whatever the science might be saying. I did want to point this out because it didn't necessarily focus specifically on HIV/AIDS, but there are some areas that I think are relevant. And so if you're not familiar, I would suggest taking a look at this. This was a systematic review of the health effects of cannabis and cannabinoids, and there was kind of, they kind of had tiers where they actually rated kind of the evidence that's available for different conditions, popular conditions that people have, like cancer, et cetera, that people are often using medical cannabis for. And so I would certainly suggest that you take a look at that. And you'll see here, I just pulled out some of the things that might be especially relevant to this population. Just kind of around, immune status, inflammation, anxiety, et cetera. So just want to put in a plug for that. I also just wanted to talk about a study that I did back in 2019 with several of my colleagues who, again, I want to give a huge shout out to them because, again, my area of focus is, and a lot of my research is within the cannabis space. And so really focusing on kind of the HIV continuum of care and really kind of leaning on my colleagues to really help us think through these issues. And so what we did was a systematic review to think about cannabis use along that continuum of care. So, from the time that a person is diagnosed to engaging them in treatment and, adherence to ART medications, and just think, retention in HIV care, looking across all of these different stages and seeing if and how cannabis does impact the continuum of care. And as you'll see very briefly in the abstract, we did not find many studies that looked at this. So of course, this is an area that needs more focus. But one thing that we did find was that there is an association between cannabis use, especially heavy use, which is oftentimes defined as daily in a lot of the studies that we read, and actually learning about the status of HIV and the kind of the diagnosis phase. So especially in that early phase, it might be a good time to intervene and really think about how how cannabis is impacting the trajectory, and does it, people continue to go on and use, and what does that do over time to individuals in this population. But again, kind of as most of this, and really the take home message is that a lot of our studies are findings, can be inconsistent, inconclusive. And part of it is for the reasons that I mentioned before, with not really having a clear standard, dose of what cannabis use is, type of product, et cetera. So that's, unfortunate, but there's a lot of room for growth. And so the cannabis and HIV connection. So I wanted to just highlight here kind of when we think about some of the popular reasons of what people are typically saying or why they use cannabis specifically in this population. So I talked about the appetite stimulation and weight gain and wasting, age-related wasting syndrome, neuropathy, and it's inconclusive. But also and I'll talk some more about that point on the next slide, but it also can help people cope with the diagnosis, cope with engaging in treatment. If you think about just the general use of people using cannabis and saying that it helps to reduce stress and can help people relax and, perhaps engage with news that may not be favorable, et cetera. So, so it kind of, you can kind of think, you can kind of see that connection there. And then, as I mentioned, there are use for medical conditions other than HIV. So that, the arthritis, the chronic pain, et cetera, especially among, again, individuals who are older, that might be a special issue, especially an issue that needs to be considered. And in fact, in some of the survey work that I've done here in Ohio, just around the use of medical cannabis and understanding who our patient population is, what I found is that it's really almost rare for someone to just be using medical cannabis just for one condition. So the way that the program is set up is that you, of course, get that one, diagnosis, let's say for cancer or for HIV/AIDS, you get that diagnosis and then you're eligible for a card, and that's kind of what it says on paper. But when you dig a bit deeper, you also find it's like, oh, well, I also have pain and glaucoma and all these other issues that are going on. And so oftentimes they may say, well, yeah, I have it for this, but there's other pieces there as well. And so they may not be able to point to exactly what it's helping with, but they know that, it's providing pain from at least some sort of relief or some, help with whatever conditions they might be experiencing. So that could be, one of the reasons why this deep connection between the two. And then, of course, we know, and I always say this wrong, dronabinol, I think it is how it's said, contains a synthetic cannabinoid. And it's actually approved by the FDA to treat the loss of appetite and weight loss in people with HIV and AIDS. And so I put this here because, again, this is one of those things where kind of like I talked about the legal status, and people see these things and they say, well, of course, it's legal in so many places and there's these different laws coming out. So of course it's safe. And that can be kind of a general perception that people have, but it's important to note, and this might be where that education piece comes in when we talk to patients and our populations that we work with, is that this, again, is FDA approved. So there's this, a process that went into, into making this, safe and effective for the public. And it's also a synthetic cannabinoid. And synthetic cannabinoids have been unfortunately marketed as kind of this safe alternative to like THC products. And that's just simply not the case. These synthetic cannabinoids are kind of these human-made, mind-altering chemicals, and they can be similar to cannabinoids, which is why kind of similar to what we see in the cannabis plant, but it's not the same, and oftentimes can actually have more harmful effects than THC. And so it's not seen as something that's, just kind of this safer alternative to, perhaps some of the negative effects of THC. So it's important to kind of have that education around, the use of this medication and how it might be different than just say kind of just recreationally using cannabis to treat some issue related to cannabis. As I mentioned, there's neuropathy and different pain associated with, and oftentimes this is often due to a side effect of ART medication. And so when we dig deeper, we see that among people living with HIV, it's about 20 to 30% use cannabis for pain relief. So again, that's an area that's of extreme importance, and why that might, medical cannabis in particular might be, the use might be particularly high. And then when you think about wasting syndrome, which is, associated with, no appetite, diarrhea, fatigue, et cetera. But then when you have, cannabis that can help to stimulate the appetite and control nausea, you can see, these large numbers here of folks with HIV are using it for those purposes. And again, even just kind of in the general population, you may hear people talking about, appetite, for example, or people having the munchies as a result of using cannabis. So that's, a very common thing. And then, as I mentioned, to cope with anxiety and depression. And then, of course, ART, and there's the side effects with it, and then other medical conditions. So essentially, this is kind of just wrapping up the pieces about the connection between the two and why there might be, higher rates and kind of the perceptions that people have, whether or not the science, speaks to that or not. So what I will say about those areas is that cannabis and HIV, there are mixed findings more broadly. And so when we talk about, all the things that I mentioned about the neuropathy and the appetite stimulation, there may be some areas, especially with like appetite and things like that, where the research might be a bit stronger. But again, think back to that slide that I gave you about, cannabis research and just really kind of reading into the details of what an individual might be consuming it for their appetite stimulation and how that might impact them. So all of this is, mixed. And so that's kind of my take home message with that, is that the evidence is mixed, but it is important that we provide what we do know to the people that we're working with so they can make educated decisions. And part of what we do know is that there may be cannabis, might help with certain areas and certain symptoms, but we have to remember that cannabis has also been associated with learning and memory impairment. And this can be extremely problematic, especially among individuals living with HIV, because then when we think about how that might affect non-adherence, for example, to ART, kind of forgetting to take, medication, and that can be problematic. And then also we know like the use of most recreational drugs tend to kind of lower adherence to ART. So we have to think about, the implications of that piece as well. There's also mixed findings related to cannabis use and adherence. And so, when we think about cannabis use and nausea, there have been, again, kind of strong evidence in that, when people are using cannabis to decrease their nausea, then that, they're more likely to remain adherent to their ART medications. But when they're using it for anything else other than nausea, or when there is heavy use, of course, that does not, fare well with adherence. So you have to really be careful when we talk about these issues. Cannabis use is also associated with an increased risk of other substance use and mental health problems, disorders. And this, again, is, specifically in this population, but also in the general population. And so we have to think about, just, like with alcohol, for example, which could also, lead to memory impairment issues, or the tobacco, with kind of these HIV related oral lesions. And so not only are you, maybe the cannabis might be helping with a specific symptom, but you also have to think about the other things that it might be at a higher risk for, like these other substances. Mental health, I've already talked about anxiety and depression, which could, come on as a result of a diagnosis, or, could be there prior to that and could just be exacerbated throughout by the use. And so, we don't really know which one comes first, but in any case, there could be, just this association between those two that, is not favorable and will put people at an increased risk for either the onset of these issues or the exacerbation of these issues. And then, of course, we have to think about there's been changes in both the cannabis and the HIV/AIDS landscape. And what I mean by that is that, with cannabis, the laws change every day. The potency levels of cannabis are much more different than they were, decades ago. And so we have to think about, as we're talking about cannabis use, and especially if you're getting cannabis, just off the street, what does that mean? What does that look like? It's not regulated. You don't know what it is. It could be laced with other drugs. It could be, you just don't know. You think you're getting a certain product and it may not be that. And so you have to, always think about that. And then even with HIV/AIDS, there's been so much that has happened from the beginning with the inception of this until now, where there's earlier identification, much more better management, et cetera. And it's not necessarily considered, when you think of it when it first came out, of like a death sentence, but it's not considered that anymore. And so we have to think about the approaches and strategies that are used to manage things that don't have to be as drastic. And it's not like cannabis has to be that go-to thing. There are other approaches and ways in which, when we think about coping with the diagnosis, for example. So there's a lot. So it's deeper than just, should I take cannabis or not? You have to think through all of these issues and think through how it might impact, these areas as well. Another area I want to point out is around cannabis use disorder, which, there's back and forth sometimes with this, whether or not is it a thing, but it is a thing. It's very much real, just like there is a stimulant use disorder, a tobacco use disorder, alcohol, et cetera. The same thing can be said for cannabis use disorder, in which you see here the symptoms are 2 or more of these symptoms in a 12-month period. So when you look at, consuming larger amounts than intended, the high tolerance, the, physical safety at risk, damage to interpersonal connections, et cetera, strong cravings, these things are very real. And, I have, and when I was seeing patients, I have treated individuals with cannabis use disorder. So I've seen it in action, and seen how it can impact a person. And so, anytime you use cannabis, whether it be for medical or recreational reasons, there isn't, a risk for cannabis use disorder. So it's something to always be monitoring. And that's why I think it's important to keep open communication between, whether it's providers and patients, or whatever that population might be, because, there's opportunities to observe, if you see any of these symptoms, or having someone talk to you openly about, I'm using cannabis, it's helping, but I'm also noticing that, it's kind of ruining my relationships, or I'm having a craving to where I get up and I feel like I have to have it in order to start my day. Those kind of things, you can kind of start monitoring with people and, think about, what are the strengths, what are the weaknesses, and kind of weighing those pros and cons for your particular situation when using. And so, as I've mentioned a few times in this presentation, the science, it is what it is. And we, I definitely have some work that we need to do in this area, but there has been a great deal that's been done up until this point. So we do have some information. So I think that's a good thing that we should know. Another thing is that regardless of kind of where we stand on the issue, it's here. And so rather than thinking about, whether I'm telling someone do use it or don't, more so thinking about it from a perspective of it's here. So what are we going to do now? And so with that, back to the point that I was making in the previous slide about asking about cannabis use, having screeners and treatment that specifically ask about, are you consuming cannabis, in what way, what kind of products are you using? Because that could be a teachable moment of, okay, if you're using this particular product, just keep in mind that, this is how it might impact your body. Or this is, what we know, these are the studies that we have about this particular issue. And so just be mindful of these things when you're consuming. Or here are some recommendations about, in some cases, dose, that's, again, because as I mentioned before, we still need some research in that, more research in the area, but just to kind of give people a general sense of things to think about. And I think, I can't say that, any stronger, because I feel that I have a lot of people that I talk to in my research who say that they're afraid to talk to their primary care provider, or afraid to talk to people about their cannabis use in general, and, specifically for their medical condition, because there's a stigma that, oh, well, you're just going to use it because you're trying to get high. You're not, and so there's all this stigma that's there, but having that open conversation. And oftentimes it's not even always just stigma, but it's also just thinking about, okay, on the provider perspective of thinking about liability, thinking about, do I have the right words to say, the right tools to give to someone who says that they are using or are interested in using. So there's a lot of pieces that go into it. There's a lot of places for us to kind of fill in gaps in the research. Another thing is that we have to think about alternative strategies that don't involve cannabis. And so if you do have, someone who's living with HIV, they want to use cannabis to reduce, their nausea or anxiety or other things that I kind of mentioned in this presentation. Those are not cannabis is not the only strategy that can, help with nausea, that can help with anxiety, that can help with any other issues that might be going on. And so kind of doing the research to figure out what are some strategies that we can share that may not necessarily involve cannabis use. So that's not the only thing that people are leaning on and feel like that's all they have. And I will point out that this is, extremely important because again, in some of my work around cannabis, medical cannabis use here in Ohio, is that the people that are using cannabis, they've typically, by the time that they're at the point where they decide to get a medical cannabis card, they have exhausted every option. They've tried every medication. They've been a part of every clinical trial. Everything that they could possibly do, they've done it at that point. And so they're really just looking for anything to kind of get some relief from whatever their condition might be. And so it's even more important that we think about, alternative strategies and especially ones that may not have been presented already because they may have already tried that. So it is, can be difficult, but I think it's worth the conversation at the very least. Again, I'm kind of driving home the point about education. And I'll just put education and research together, just in those, two areas, because I think they, obviously go hand in hand in informing our patients and people that we work with about what we do know, also informing them about, what we don't know and the questions that we still need answered. And meanwhile, while we're kind of working behind the scenes with the science to figure these things out, here's what we can share with you. Here's some things to think about as you kind of navigate the journey of using cannabis or considering the use of cannabis. And then lastly, just understanding that cannabis is still illegal at the federal level. So I showed that there's across, all these different states, there are so many different laws and rules, et cetera, about the use of cannabis, but it's still illegal. And so there are, you just want to be mindful of that whether you have it on you and transporting it across states and you have to be aware of those laws and the rules, and even just within a state, and especially in places where it's been decriminalized, like I know here this decriminalized and in certain amounts are decriminalized in certain parts of the state, but but it are within townships, but then you go like one street over and, those same rules don't apply. And so then, so you have to just be mindful of, carrying it on you and whether or not, where you can use it, how you can use it. Also knowing that, smoking cannabis is again, a common way of consuming cannabis, but even within our medical programs, smoking is typically not allowed. It's typically you have to vape or, edibles or some other form. So knowing the rules and knowing that, if you do decide to do this, there are rules associated with programs, there's laws that you have to follow, because you certainly don't want any, legal issues related to the use of cannabis, because that of course can only exacerbate, everything else that's going on. So just really, like I said, what I'm pushing for and what I would hope that, we all would push for is just a stronger understanding of the landscape of cannabis. We don't have all the answers. There's so many, questions that need to be answered, but we do know a few things. And so I think what we do know, we can share with our population. And that we, most importantly, be open to the conversations and not shy away from them, because again, this is the reality and kind of where we are now. So just want to be mindful of that. So that's it. So thank you so much for allowing me to present the work here. I'm happy to answer any questions. And I know I see a few in the chat, and so, but I'll turn it back over to Allison.
That was fantastic. Thank you for that. And I think you made a strong attempt to make sure you answered some of the questions that people had beforehand. So I'll start with the ones in the chat, and if there are any that maybe we felt weren't answered, I'd go to that. So first, I want to highlight Joan Park asked, first said, kudos, great talk. But as an HIV provider who takes care of adolescents and young adults, she wanted to hear about how cannabis differs, or the effects differs between adults versus adolescents living with HIV, and maybe even adults versus adolescents without. What are the differential effects on those populations?
Sure. And that's, it can be tricky because especially when we think about adolescence and the developing brain and, cannabis can have different impacts in that way. And so, the messaging is often different because, the idea would be that we would not want, there'd be cannabis use there. But as we know, people, even adolescents can use medical cannabis. And so, with that reality, I think it's important, again, to kind of draw home like some of the points that I was mentioning about the ways in which cannabis is consumed. So, for example, smoking is a very popular method, but that's often not the way that, programs, across states prefer that people use it or allow people to use it, I should say. And so being aware of that and understanding why that is and, explaining, this is in explaining the use of it for medical reasons versus kind of using recreationally. And that can be hard to explain. I mean, even among adults, just trying to explain that the difference and why is it okay for this, but not okay for that. But just kind of to the extent that we can explaining, this is kind of how it works. And it kind of specifically targets, let's say appetite stimulation or, wasting syndrome, whatever it might be. Versus kind of like, the recreational use where, there's not really a clear, it's like, what is, and kind of weighing the pros and cons and what are you hoping to get out of it? And also always checking in about how it's impacting a person's body. So if they are using, the constant check-in, to look at, cannabis use disorder, because again, that is a real thing. And so those constant screeners, constant questions, open conversation, I think that can go a long way.
No, I definitely appreciated that you not vilifying it, right? Because it's a reality, it's happening, and people are using for a reason. I did appreciate hearing about how do we know when it's a problem, right? So what the definition of a disorder is. But oftentimes I think I struggle. I can tell if you're smoking 7 blunts a day and you're sitting at home, you've gotten a car accident, you have an issue. But I think many of the providers on the call could have the same thought. What do you do about it? Because I struggle. Maybe you can give us some insight in that.
Sure. Yeah. So there are treatments. And so like, in like cognitive behavioral therapy, motivational interviewing, like similar strategies that you might use for other substances that are effective. And so definitely like theory-based things are there. But I think, again, I think that the most important thing is just that kind of that screening, understanding, like thinking about people and their use. And so what I typically do, especially with like young folks, is I might have them walk me through kind of an average day of their use. And so and then in that process, understanding, okay, if you're smoking, 7 blunts a day, what's typically happening, throughout the day, and are using other types of products. How much cannabis do you typically put in there? Especially with blunts, are you using in a group? Are you using by yourself? Because that, often has implications for how much they consume, because usually if they're in a group, they're consuming less because they're passing it around. So those kind of details, like getting to the nitty gritty of understanding their day, but also how it impacts them as. And so I noticed, like I can see in some of my like adolescents and younger adults that I work with, when they're consuming so much cannabis, there's like this amotivational syndrome where it's kind of like they're like just kind of blah, nothing matters, whatever happens, happens, I'm just I'm just kind of chilling and it's like, well, especially if I notice a difference, like if I see someone that's kind of like, vibrant and, has all this personality, and then they all of a sudden kind of just like sitting around just on the couch, just like, like those kinds of things. And I think it's kind of where I go back to like the building that relationship and being able to kind of talk with people about, well, I've noticed, I'm noticing that, I know you said you smoke, 7 blunts a day and you're saying that it's helpful, but I also noticed that, you're not as upbeat as you used to be. Or I noticed that you're not as excited about this particular activity that you used to like or used to do all the time. I
Yeah.
wonder what that's about. Tell me about that. And
Yeah.
so like, those kind of, I think I found that to be really helpful where, it's again, not kind of beating people up, but also just kind of pointing out that there are some differences there and that, and asking them like, you see any changes, or here's the list of things, that we see with cannabis use disorder. Do you think any of these apply to anything that, you've seen for you, or have other people said, that they've noticed these things in you? So those might be some ways to kind of, get in there and talk with folks.
Yeah. There's a question from Dana about what are your recommendations, for schools as they address youth cannabis use, given many of our kids are not just in our medical spaces, but others, but just what are your thoughts or what are your recommendations for those?
That's a great question. And it can be tricky, especially, in schools, because then you have, some parents are kind of like, I don't want to touch the issue. Don't talk about it at all. Others may say, yes, please, I want to know about the prevention, everything. And so I think with everything, it's just a matter of, for those who, parents that provide permission for that, having that sort of marijuana prevention information within schools is something that an advocate for, just like with any other substances that we might be working to prevent in the school setting. So I'm certainly an advocate for that. But what I'm also an advocate for, where it becomes even more trickier with cannabis, is that, like I was talking about with the recreational and medical piece, and understanding the differences of why, recreationally this might help someone, and this is what it targets, versus they're just using, just for fun or for pleasure. And that's not always an easy conversation to have. It's not always one that, quite honestly, even as a scientist, makes sense, even in our, kind of academic conversations about it. So, I think, but having more research that is kind of targeted towards the development of these sort of toolkits and interventions that can focus on these areas, I think are important. And especially in schools where you can target, multiple kids at once would be ideal, but you have to keep in mind kind of the landscape of, the state you're in, and, and parents and permission and all those kind of things. So it's tricky.
Yeah. Well, I am recognizing the time. I think we could talk about this for a long time, and I would love to have people with their additional questions, given that we're at the end. Please send them. And if Dr. Montgomery, if you're willing to answer, there's some questions about hormones and men and all that stuff. If you could answer
Absolutely.
that. Thank you again for sharing your expertise. This is something you showed the stats, and I think we're seeing it in our clinics. And I think it was so important for you to talk about the nuances of this issue. It's not black and white for everybody, but I think even thinking about how to ask the questions to even get to where it is was so important in understanding how this marijuana impacts our patients. Again, thank you for your time. Thank you everybody for your attention. Yes, we'll share the slides. Yes, the recording will be available, and we may have you back as the laws evolve, but thank you again.
Of course, thank you so much. Thank you for the invitation. I enjoyed it.
Absolutely. Take care, everyone.
Bye.